Hello staff, welcome to the third installment of Mental Health Awareness. Today we'll be discussing exercise with the mental health diagnoses that were discussed over the second installment. Prior to that, I would like to just make a few announcements. This week is a big week. We are collecting money all week for our Wall of Honor. Remember, we're putting a t-shirt together. On the back of that t-shirt is going to have multiple names of people we would wish to honor for mental health awareness. This t-shirt will involve a $5 donation. You will put your name on a card, and then you will put the name of the honoree that you want to place on the back of the t-shirt on the same piece of paper. That will be available on Amy Dwell's desk and Amy Childers' desk. So please put the $5 in the envelope and also put the paper with your name and the honoree's name in the envelope as well. We want to make sure everything is printed legibly so we can get that t-shirt put together and hopefully out for ordering by early April. And on that note, we still have the mom race coming up, so if you wish to join the mom race, remember we have Team Hope at 14 Mom 2019 is the password. Once again, that's Team Hope at 14 Mom 2019. You do not have to be part of that team. You can join independently if you wish. Just keep in mind with the Wall of Honor that we're creating, all donations this year will be donated back to our department fund, which is 78138. Currently, this is the only fund that gives us an opportunity to represent mental health through the use of our own social work while using the Beaumont Foundation. If you guys have any ideas how to create another fund for mental health, please bring it my way. All suggestions are welcome. However, this year is pretty much set in stone. If we do this again next year, hopefully we can have a dedicated Beaumont Foundation fund. And I believe that is all my announcements. So please wear your jeans, bring $5, and donate a name. The objectives of this part 3 is a recognition of the psychological and social well-being gains from exercise, to become aware of the barriers within the rehabilitation field. Adding exercise as an adjunct can be an enhancer to the stabilization of the psychological disorders, and developing a goal within a care plan for continued exercise tailored to the individual is appropriate for improving both function and quality of life. There are many barriers that involve connecting psychological health and well-being into the rehabilitation field. A recent study involving physical therapists assessing these barriers with physical activity among persons with schizophrenia resulted in 2 major identifiable barriers, and one is a lack of motivation from the patient themselves, and the other is the lack of priority given to physical activity by other healthcare professionals. I just wanted to add one other caveat to the barriers. There's a lot of research out there that focuses on cognitive effects, and I just want to differentiate that between the psychological mental health awareness that I'm talking about. Cognition does not equal psychological. Cognition is your involving activities of motor coordination, short-term and long-term memory, impaired judgment, whereas the psychological is the focus of the emotions, the thoughts, and the behaviors. Research has shown that the effects of moderate physical exercise, whether aerobic or aerobic combined with strength training, or even as a multimodal treatment in conjunction with chronotherapeutic intervention, which is a wake, light, sleep stabilization intervention, may assist in the reduction of depressive symptoms, improve sleep, improve neurobiological impairments and behavioral symptoms, which are associated with major depressive disorders and bipolar disorder. The idea of exercise as an adjunct to treatment in schizophrenia is nothing new. As Faulkner summarizes in his report,
numerous forms of exercise dating from 1960s through early 2009 have resulted in positive gains over a 24-week period. This exercise was non-specific, as I mentioned, walking, jogging, and aerobic as a few. The conclusion that Faulkner came up with in his reports is that physical health for people with mental illness is a realistic goal. However, more research needs to be done on how to assist these individuals to adopt and maintain physical activity. The majority of research has focused on aerobic activity. There is currently no set criteria as to dose response and exercise volume as it relates to any depressive disorders as reported by Smith in the Routledge Handbook in 2014. There is evidence that people with depression that continue with exercise over a 10-month period have less depressive symptoms than people that were placed on Zoloft alone. There is also high quality of evidence that physical activity reduces depression in non-clinical populations. When determining the type of exercise that is appropriate, it is best left to the individual and the tolerance to their comorbidities. For example, a patient on hemodialysis may benefit from one program versus a patient in post-cardiac care versus postpartum patients. Qualities of life may be influenced from the time the patient enters the healthcare system through all stages of mental health disease. Adapting the exercise as determined by the patient's response to exercise, the quality of life can remain positive. As rehab professionals, we should create goals focused on physical activity, encourage exercise maintenance programs to assist the patient population in a healthier lifestyle, not unlike our patients with chronic conditions. Care plans should be inclusive of follow-up weeks later to check in on their progress. Patients that have been identified as having added mental health comorbidities should have long-term goals taken into account as it pertains to long-standing exercise programs. And for the first quiz question, multimodal treatment of exercise and chronotherapeutic intervention has been shown to assist in improvement with depressive symptoms. True or false? The answer is true. Research shows that psychological disorders in patients that have symptomology of depression should be treated equally, especially when exercise is incorporated into treatment plans. True or false? The answer is false. Everyone should have their own exercise plan, not an equal plan. Thank you very much, and I look forward to having one last discussion with you in a couple of weeks.